Having a baby is one of the happiest and most exciting experiences a woman can have. There are many emotions and sensations involved. Pain is one of them.
Yes, it was painful, but every contraction is one contraction less. You've got to think of it like that. And you get something at the end of it.
You hear so many different stories from so many different people. And talking to the mums in here now, we're all just so different. And, you know, the amount of time you took to have them varies so much. But I'm glad it's over. And then I got through it now.
I feel great. I feel really good. Yep. Let's have another one tomorrow.
So, pain can vary a great deal between mothers. It may be something that you can handle on your own, or you may need help with it. We have made this video to give you some idea of how you can cope with labour pain and show you the different ways in which we can help you. For some women, the pain of labour can be removed completely. But the main emphasis of pain control is just that, controlling the pain, not eliminating it altogether.
I was happier about the pain rather than the pain going, I think. And it relaxes you and makes you not care about the pain rather than actually taking the pain away.
So often, just easing the pain of labour is enough to make it bearable. The idea is for you to experience the sensation of your baby being born without being too distressed. Reactions vary. What one mother considers pain, another may experience as discomfort. And the factors causing pain can vary enormously between different pregnancies.
It was down here, in the lower abdomen, but mostly on my back, down there, like a sort of menstrual pain.
I mean, some people suffer the pain all in the front, some people suffer it from the back, some people suffer it everywhere. And mine, as I said, was all round the back.
Whatever your expectations for labour, attending a relaxation class is a very useful part of preparing for the birth. Relaxation can help enormously. It's best to learn and practice the techniques beforehand. Changing position, rocking your pelvis, and even walking about can all help and may let labour progress quicker. Get your husband, partner, or whoever you choose to be your companion to participate. It's a good idea to attend antenatal classes and talk things over with your midwife and physiotherapist. For many women, practicing a relaxation technique may be enough on its own to get them through. But you may need some more help, which we'll look at in the next part of the video. TENS is a very simple and safe type of pain relief. It stands for transcutaneous electrical nerve stimulation. Soft electrodes are taped across your lower back, and a very small electric current is passed through your skin. It causes a tingling feeling which masks the pain. It's the same effect as rubbing your skin when you've hurt yourself. You can vary how much it tingles, and there's a button which you can press to give a boost during contractions. TENS is a physical method of pain relief which doesn't involve drugs. Many mothers find that as labour proceeds, they need something more for stronger pain. But TENS is useful because you can start it at home. You may be able to get hold of a TENS machine in advance from the hospital or hire one privately.
Well, I practiced with the TENS machine leading up to the birth, because I understand that's what you're meant to do. And I found it very good in the early stages, but not very effective as it went on.
TENS is simple and safe, doesn't involve drugs, and can be started at home. Most people find that the sensation of water against their skin is soothing. Using the water bath in labour helps you relax and also makes you more comfortable by supporting some of the weight of the baby.
I went into hospital at about 12:30, 1 o'clock, and went into bath straight away, the birthing pool, and that was fabulous. It was so relaxing.
Using the water bath for pain relief is simple and safe. It doesn't involve drugs. But there may only be one in each maternity unit, so access may be limited. In this video, we're only describing how the water bath is used for pain relief. We're not talking about water deliveries. INTERKNOCK, which is also known as gas and air, is the most widely used form of pain relief. Most mothers use it at some stage in their labour. Because you inhale INTERKNOCK, it works very fast, but it still takes half a minute or so to be most effective, and it also wears off very quickly. So timing is crucial. As soon as you feel that a contraction is about to start, breathe in the gas and air. Keep going until a contraction has passed its worst. You need to stop and take a break between contractions, or you could end up feeling a bit dizzy or sick. But the gas itself doesn't smell or taste of anything.
You're in control. You have the mask in your hand, and it's entirely up to yourself how often you use it, when to use it. And I think that it gives you a much more controlled, you're much in control of your birth as you can be, which is, to me personally, a very, very good thing.
When you're using INTERKNOCK, try to breathe normally. Don't pant. You can choose to use a mouthpiece or a mask. Whichever one you use, it's important that it makes a good seal around your mouth or face. The whooshing noise is the valve opening. If you don't hear it, you won't be getting any INTERKNOCK. INTERKNOCK is quick, effective, and free from serious side effects. Dizziness and sickness are less likely if it's used properly. If they do occur, they wear off relatively quickly. PETHidine is a painkiller similar to morphine that is given by injection. As well as relieving pain, it's a sedative and can help you rest. This may be helpful in the middle of a long labour, but being too drowsy in the later stages doesn't help you, and your baby may get drowsy too, so there's a limit to how much you can have.
It worked quite fast, and it was very good from my point of view in that the contractions were coming so quickly, and they were so painful that I just needed something to take the edge off of them. You were still sort of feeling something, but because it basically puts you to sleep almost. Makes you very drowsy.
The PETHidine just took me away from what was going on, and obviously relaxed me. And I suppose when your muscles are relaxed, you don't suffer pain so much. But it wasn't long before I actually did something else, because my backache became so severe that the PETHidine really didn't do an awful lot.
You're still conscious of the pain, but it dulls it slightly. It's a lot easier to cope with, especially being the first and you don't know what to expect.
PETHidine is a useful painkiller for some mothers, but it has some predictable side effects. The commonest are drowsiness and nausea. An anti-sickness drug may be given with PETHidine. PETHidine may cause your baby to be drowsy. If there is any concern that your baby is sleepy from the effects of PETHidine, it will be given an antidote. An epidural is a type of local anaesthetic which blocks pain impulses before they reach your brain. So an epidural provides very effective pain relief without causing drowsiness or dizziness. Because we inject the drugs into the epidural space, it's very unlikely that enough of the drug will reach your baby to cause any noticeable effect. We get the anaesthetic to where it's needed by putting a small plastic tube or catheter in the epidural space of your lower back. Despite what you might expect, the epidural injection isn't normally painful because we numb your skin with local anaesthetic first.
You have a slight sensation of a liquid going up your back when it goes in, but nothing painful. I'd heard they were painful when they were actually put in by different people, but I didn't find it painful at all.
The effect of epidurals depends on what's put through the catheter. Nowadays, the aim is to take away most of the pain of labour without causing complete numbness and weak legs.
The pain just went totally, you know, it had worn off enough by the end, so I knew that I had to push and I could feel, but it wasn't, it still numbed it, you know, you didn't feel everything.
Most mothers prefer to be able to feel the contractions to some extent, to be able to move about and be able to push. This can be done by using weak doses of local anaesthetic and morphine-like drugs. The weak solution will help you cope with the pain and may also let you stand or sit down, whatever's most comfortable for you. In some cases, you may even be able to walk around. Epidurals need more preparation than other methods of pain relief. First, we set up a drip, a precaution against your blood pressure falling. The equipment has to be prepared. You need to curl up, either lying on your side or sitting up. Then we apply antiseptic and local anaesthetic to the skin. We insert the epidural needle. At this point, it's very important that you keep quite still. If necessary, the anaesthetist will pause if you have a contraction. Once the epidural catheter is in place, pain-killing drugs can be injected, continuously by means of a pump, or topped up by hand. Once it's working, the epidural can be kept going right up until your baby is born. We will check your blood pressure regularly. Some epidurals aren't fully effective. If you're still in too much pain, then further doses of anaesthetic or changing position usually help. As with any treatment, complications can occur, but serious long-term problems following epidurals are very rare. The commonest side effects are low blood pressure, some numbness, and weakness of your legs. But the modern approach to epidurals means these are less troublesome. Long-term nerve damage is extremely rare. You may have heard that you'll get backaches and that you'll be more likely to have a forceps delivery if you have an epidural. There's no clear evidence that epidurals cause these things. It may just be that mothers who choose epidurals include those who have more difficult labours. With about 1 in 100 epidurals, there's a complication which could cause a severe headache lasting several days if it wasn't treated. Normally, we can spot the complication and treat it. Having said all this, about 1/4 to 1/3 of all mothers have an epidural, including about half of women having their first baby. If your baby has to be delivered by a caesarean, it's very easy to boost your epidural so it works as an anaesthetic.
I hated the thought of anybody tampering with my back. The fact that something was put into your spine really frightened me. And I just thought, oh, I can cope with whatever happens, I want to avoid that. But as time went on, I suffered a lot of pain in my left hip, which is sort of, really unbearable. And I just wanted anything to take it away. And I found the epidural really good. It didn't hurt when it went in, became effective very quickly, and I even had a top up as well because it started to wear off.
I got to the point where I just couldn't put up with it any longer, and I knew that I wouldn't be able to keep going for a very long time, so hence the epidural. But it was bliss to have that pain taken away. So it made, obviously because of the forceps delivery, it made it much better as well.
Epidurals aren't an immediate form of pain relief. They have to be inserted by an anaesthetist. There's always one on duty for the labour ward, but sometimes several mothers want epidurals at the same time, so there may be a delay in setting yours up. If you'd like an epidural, it's best to ask for it as early in labour as you can. So, epidurals are the most complicated form of pain relief, but also the most effective. Pain control is an individual matter because the things which influence pain, such as the baby's position, can vary a great deal between mothers, and every mother has her own ideas about how she wants to deal with labour pains. It's helpful to think about your preferences and concerns beforehand, perhaps as part of a birth plan. This may influence you in choosing where to have your baby. For instance, not all maternity units can provide epidurals. Thinking about pain control beforehand will give you opportunities to find out more about different methods. Ask questions now. You won't want to worry about this in the middle of labour. When you first arrive on the labour ward can be a good moment to go through it with your midwife and the anaesthetist. There are two ways of looking at pain relief: how you can help yourself and how you can be helped by us. You may not need anything more than reassurance from us, but here's a reminder of what is available. Relaxation can help enormously. It's best to learn and practice the techniques beforehand. The water bath is very soothing. TENS doesn't involve any drugs, but is often not enough during a long or difficult labour. You can start on it at home. You can use INTERKNOCK as and when you need it, and it acts quickly. INTERKNOCK and PETHidine can both cause you to feel a little strange, though with INTERKNOCK it's usually mild and wears off between contractions. Epidurals are the most effective form of pain relief, in the sense that they can remove pain completely in most cases, even when all other methods have failed. They take the most time and preparation, but they can be kept going until your baby is born. Throughout your labour, we will give you support, reassurance, and advice about what is best for you, and help you cope with the positive pain of labour.
You know, people can tell you, yes, it's painful, and yes, it feels like this, but until you actually go through it, you can't really listen to what anyone else says, really, because everybody's different.
I said that I wouldn't like to have any pain relief, and I had everything, so just try and be relaxed, and don't be afraid to say you need something, you know, it's no shame in it. Yeah, I'll do it again tomorrow. Well, once the stitches have healed.